Hi and Assalamualaikum. My name is Izhaq Muttaqin by Madzli and I am from class 4 Jazari. Today I'm going to talk about gastritis and anorexia nervosa. First of all, what is gastritis? Gastritis is an inflammation of protective lining of the stomach. There are two types of great gastritis, which is acute gastritis and chronic gastritis. Acute gastritis is a sudden severe inflammation, while chronic gastritis is a long term of inflammation that can take many years if it is untreated. As you guys know that our stomach has a protective lining. It called mucosa. The lining protects you from the strong stomach acid that digests food. When something damages or weakens the protective lining, it causes mucosa to inflame and causing gastritis. Usually, bacteria such as Helicobacter pylori is most common bacterial cause of gastritis. It transmits through contaminated food and water. The activities that may increase the vulnerability gastritis is extreme alcohol consumption, routine use of non-steroidal anti-inflammatory drugs or as known as NSAIDs, cocaine, age and acid tobacco use. While less common risk factor is stress, autoimmune disorder, digestive disorder, and virus infection. They have many symptoms that does not cause noticeable by everyone, such as nausea, vomiting, a feeling of fullness of your upper abdomen after eating, indigestion, loss of appetite, and also hiccups. But for erosive gastritis, it will add blood, tarry stool, and vomiting blood. There are many ways to avoid and treat gastritis, such as avoid or less taking spicy food. As example, ramen. We also can take antacids and other drugs such as proton pump inhibitors and histamine or as known as H2 blockers to reduce stomach acid. For the Helicobacter pylori bacterial infection, it will prescribe several antibodies plus on acid blocking drug, while for permanent anemia infection, B12 vitamin shots will be given. Lastly, limited irritating food forms from your diet such as lactose from dairy and gluten from wheat. Okay, now I'm going to talk about anorexia nervosa. Anorexia nervosa, or often known as anorexia, is an eating disorder by an abnormally low body weight and fear of gaining weight. People with anorexia place a high value of controlling their weight and shape, using extreme efforts to significantly interfere with their life. They usually restrict the amount of food they eat. They will vomiting after eating. Although the symptom is not clear which genes are involved, they might change people's perspective. In biology, some people may have genetic tendency towards perfectionism and sensitivity, all traits associated by anorexia, while in others' perspective, it caused by the environment that made her to change her eating style. For the symptoms, there have many and are related to starvation, which is fatigue, insomnia, dizziness, or fainting. They have three methods to treat their anorexia. First of all is psychotherapy. It is to change the way of thinking and their behavior. Next is medication. Symptoms of antidepressants medications might help to control their anxiety towards food. Lastly is nutrition counseling. This strategy will create to teach approach to food and weight to help make the eating pattern back to normal, and it also to teach importance of following nutrition and balanced diet. That's all for me. Bye.
Hi, my name is Ahmad by Martadha, and today I will be talking about the topics that was given to me, which are obesity and diabetes mellitus. First, I want to talk about is obesity. Obesity is a complex disease involving an excessive amount of body fat. Obesity isn't just a cosmetic concern, it is a medical problem that increases your risk of other diseases and health problems such as heart disease, diabetes, high blood pressure, and certain cancers. There are many reasons why some people have difficulty avoiding obesity. Usually, obesity results from a combination of inherited factors combined with the environment and personal diet and exercise choices. One, the risk factors. Obesity usually results from a combination of causes and contributing factors. One of it is lifestyle choices, which is unhealthy diet. Unhealthy diet means that a diet that's high in calories, lacking in fruits and vegetables, full of fast food, and laden with high-calorie beverages and oversized portions contributes to weight gain. In order to prevent this, prevention means that whether you are at a risk of obesity, currently overweight, or at a healthy weight, you can take steps to prevent unhealthy weight gain and related health problems. One of the preventions is that you must exercise regularly. Example, you need to get 150 to 300 minutes of moderate intensity activity a week to prevent weight gain. Moderately intense physical activities include fast walking and swimming. Next, I'm going to talk about is diabetes mellitus. Okay, diabetes mellitus is a disorder in which the body does not produce enough or respond normally to insulin, causing blood sugar, which is glucose levels, to be abnormally high. Diabetes mellitus is also a disorder in which the amount of sugar in the blood is elevated. Doctors often use the full name diabetes mellitus rather than diabetes alone to distinguish this disorder from diabetes insipidus. Diabetes insipidus is a relatively rare disorder that does not affect blood glucose levels, but just like diabetes mellitus, also causes increased urination. The symptoms of high blood glucose levels include increased thirst, increased urination, and increase in hunger. General treatment of diabetes. People with diabetes benefit greatly from learning about the disorder, understanding how diet and exercise affect their blood glucose levels, and knowing how to avoid complications. One of the treatment is diet for people with diabetes. Diet management is very important in people with both types of diabetes mellitus. Doctors recommend a healthy, balanced diet and efforts to maintain a healthy weight. People with diabetes can benefit from meeting with a dietitian or a diabetes educator to develop an optimal eating plan. That's all from me. I hope you understand.
Hi, my name is Muhammad Arif Farhan bin Muhammad Zohri from 4 Jazari. Today I'm going to talk about bulimia nervosa and muscle dysmorphia. So first, I'm going to talk about bulimia nervosa. Bulimia nervosa, commonly called bulimia, is a serious, potentially life-threatening eating disorder. People with bulimia may secretly eating large amount of food with a loss of control over the eating and then purge, trying to get rid of the extra calories in an unhealthy way. Many factors could play a role in the development of eating disorders, including genetic, biology, emotional health, societal expectation, and other issues. Bulimia often begins in the late teens or early adulthood. Factors that increase the risk of bulimia may include biology. People with first-degree relatives such as siblings, parents, and children with an eating disorder may be more likely to develop an eating disorder. Being overweight as a child or teen may increase the risk. Psychological and emotional problems such as depression, anxiety disorders, or substance use disorders are closely linked with eating disorders. In some cases, traumatic events and environmental stress can be contributing factors. Bulimia signs and symptoms may include being preoccupied with body shape and weight, living in fear of gaining weight, and trying to get rid of calories and prevent weight gain using different methods. For example, they may regularly force themselves to vomit, take weight loss supplements, diuretics, or enemas after eating a lot of food. They may also use other ways such as fasting, strict dieting, or excessive exercise. You can steer someone toward healthier behavior or professional treatment before the situation worsens by foster and reinforce a healthy body image in your children. Help them build confidence in ways other than their appearance. Have regular, enjoyable family meals. Avoid talking about weight at home. Focus instead on having a healthy lifestyle. Discourage dieting and talk with your primary care provider. He or she may be in a good position to identify early indicators of an eating disorder and help prevent its development. Now let's move on to our next topic, which is muscle dysmorphia. Muscle dysmorphia is a mental health condition in which people see their bodies as small and lacking in muscle. People with muscle dysmorphia are often considered very muscular by other people since they routinely engage in muscle building activities. Muscle dysmorphia is classified as a subclass of body disorder disease. Muscle dysmorphia is much more common among men than among women. It is thought that bodybuilders and other people who lift weight are at a higher risk than the general population. People with muscle dysmorphia commonly have higher body mass index and more muscle than the average person because they usually engage in muscle building activities. It is thought that perfectionism, low self-esteem, and social anxiety may contribute to the development of muscle dysmorphia. Behaviors a person with muscle dysmorphia may exhibit include excessively lifting weight, using anabolic steroids, or other performance-enhancing drugs, avoiding social situations that may draw attention to their body, such as swimming or going to the beach, avoiding mirrors or excessively checking mirrors, eating meals in an extremely regimented way, and skipping social activities to spend more time exercising. People with muscle dysmorphia often also develop an eating disorder, particularly orthorexia. Orthorexia is characterized by an obsession with eating healthy foods. Cognitive behavioral therapy (CBT) and selective serotonin reuptake inhibitors (SSRIs) have been suggested as potential treatment since they are the primary treatment for body disorder disease. CBT is a type of talk therapy that can be done on your own or in a group. CBT targets the psychological factors that may have led to the development of muscle dysmorphia. SSRIs are a type of antidepressant used to treat body disorder disease. Your doctor may recommend them if you have moderate or severe muscle dysmorphia. This medication may take up to 12 weeks to become effective.